If you're having a prostatectomy or you've recently had one, you've probably been told that you need to do pelvic floor exercises. But there's a problem. A lot of the advice online makes it sound like the answer is simply do more Kegels, and that's not really the full story. Because what you should be doing before prostatectomy is different from what you should be doing immediately after surgery. And even after surgery, your pelvic floor training needs to change as you recover. So in this video, I'm going to break down exactly what pelvic floor exercises are trying to achieve before and after prostatectomy, when you should start them, what the exercises should look like, and some of the common mistakes I see men make. Let's get into it. Why train your pelvic floor before prostatectomy? First, let's talk about before surgery. Your pelvic floor is a group of muscles at the bottom of your pelvis. One of its jobs is helping you control urine. So when you contract these muscles, they can help compress the urethra and contribute to urinary continence. And after the prostate is removed, your urinary system has to adapt to a new situation. That's one of the reasons urinary leakage is so common after prostatectomy. So the goal of pelvic floor training before surgery isn't to somehow prevent all leakage. Instead, one of the biggest benefits is making sure you actually know how to use these muscles before you need them. Think about it like learning a new movement before you need it under pressure. If you've never properly contracted your pelvic floor before surgery, trying to figure it out for the first time while you're recovering from an operation isn't ideal. So pre-operative training gives you an opportunity to learn the movement, improve your ability to contract the muscles, and get comfortable with both contracting and relaxing them. So what should you actually do before surgery? There are a few different things I want you to think about. The first is longer contractions. This is where you gently contract your pelvic floor and hold the contraction for several seconds before relaxing. The second is shorter, quicker contractions. So rather than holding the muscle, you contract and relax relatively quickly. These two types of contractions give you different challenges. But there's another part that I think gets overlooked, and that's relaxation. Your pelvic floor isn't supposed to be switched on all day. You need to be able to contract it when you need it, but you also need to be able to let it relax. So when you're doing your exercises, don't just think squeeze, squeeze, squeeze. Think about the full movement. Contract, hold, and then completely relax. And you also want to make sure you're not compensating with other muscles. You shouldn't be clenching your buttocks, holding your breath, or bracing your entire body every time you do a pelvic floor contraction. The movement should be relatively subtle. How often should you do them? This is where you'll see a lot of different numbers online. Some programs will tell you to do hundreds of repetitions a day, but more isn't automatically better. The goal is to perform good quality contractions and gradually build your capacity. Your physiotherapist or healthcare team can give you a specific program based on your situation. And if you're preparing for prostatectomy, this is a really good time to get assessed by a pelvic health physiotherapist, if you have access to one, because they can check whether you're actually contracting the right muscles, rather than just giving you a list of exercises. What happens after prostatectomy? Now this is where things change. You've just had major surgery, so you shouldn't think, right, my prostate is gone, time to smash the pelvic floor exercises. Your body needs time to heal. There will most likely be a catheter in place, and your surgeon will give you specific instructions about when to restart pelvic floor exercises. So follow those instructions first. Once you're cleared to start, the focus is generally on gradually rebuilding your ability to contract and control the pelvic floor. And initially, the exercises may feel very different from what you were doing before surgery. You might feel weak. You might struggle to hold a contraction. You might not even be sure you're doing it correctly, and that's okay. This is where patience becomes really important. One of the biggest things I want men to understand is that urinary leakage after prostatectomy does not automatically mean you've done something wrong. It's very common in the early stages of recovery. You've had surgery around your urinary system, and your body needs time to adapt. So if you're leaking when you stand up, walk, cough, sneeze, or exercise early in your recovery, that doesn't necessarily mean your pelvic floor is weak and needs hundreds more contractions. Your recovery is a process, and your pelvic floor is only one part of that process. How should you progress your exercises? As your recovery progresses, you want to move beyond simply lying down and squeezing your pelvic floor, because eventually you need these muscles to work during real life. Think about what happens when you stand up, when you walk, when you cough, when you lift something up, when you exercise. Those are the situations where continence can actually be changed. So over time, your rehabilitation should progress from isolated contractions towards using the pelvic floor as part of normal movement and activity. And this is where your individual recovery becomes important. Not every man will progress at exactly the same rate. Some men regain continence relatively quickly. For others, it takes considerably longer. So your program should change depending on how you're responding. One of the biggest mistakes I see, don't assume that because pelvic floor exercises are good for you, doing more of them is always better. You don't need to spend hours every day obsessively squeezing your pelvic floor. You need to train it appropriately. That means learning how to contract it, learning how to relax it, building strength and endurance, and then gradually teaching it to work when you actually need it. And if you're leaking heavily, your symptoms aren't improving, you're struggling to identify the muscles, or you're unsure whether you're doing the exercises correctly, that's a really good reason to speak with your doctor or a pelvic health physiotherapist. Before I go, if you're watching this because you're about to have a prostatectomy, don't wait until after surgery to start thinking about your pelvic floor. Learning how to use these muscles before surgery can give you a head start. And if you've already had your prostate removed, don't panic if your recovery isn't happening as quickly as you expected. There are things you can do to help your recovery, but it takes time. And your pelvic floor exercises are just one part of the bigger picture. If you found this video helpful, subscribe to the channel. I'll make videos specifically about prostatectomy recovery, urinary continence, pelvic floor training, and getting back to normal life after prostate surgery. And if you're preparing for prostatectomy, I've got more videos on the channel that you can watch next.